Hello, welcome to Go Bio with Dawn. In today's video, I am going to give you a general overview of the COVID-19 pandemic. In this video, we will look at the history of the coronavirus and discuss its potential causes, symptoms, human transmission, the current treatment plans, and prevention interventions. Take note, this video does not constitute as medical advice. It is merely for educational purposes. Please do subscribe to this channel and do not forget to give this video a massive thumbs up. COVID-19 recently broke out in Wuhan, China. The first cases of this disease were first reported on the 31st of December 2019. As of the 29th of March 2020, globally there are more than 600,000 confirmed cases, more than 30,000 cases which have resulted in death, and a little over 100 of these cases which are people who have recovered. The coronaviruses date back to as early as the 1960s, with the 22GE virus, which caused the common flu, being the first to be identified. Years later, another strain, the severe acute respiratory syndrome, broke out in Asia in 2003. It soon rapidly spread to various countries in Europe, North America, and South America. Symptoms of the SARS-CoV included, but were not limited to, high fever, coughs, shortness of breath, pneumonia, and diarrhea. Later on, in the year 2012, another strain of the coronaviruses, the East Respiratory Syndrome, also known as the camel flu, broke out in Saudi Arabia. Typical symptoms of the MERS-CoV are similar to that of SARS-CoV, with a majority of patients presenting with high fever, headaches, body aches, general discomfort, dry coughs, pneumonia, and diarrhea. Now, in 2020, we have the COVID-19 global pandemic, which is a strain of the SARS-CoV viruses. In the early stages of infection, COVID-19 patients present with a fever, dry coughs, fatigue, and shortness of breath. In the most severe cases, this disease causes an array of respiratory syndromes such as pneumonia, severe acute respiratory syndrome, kidney failure, and even death. The source of the COVID-19 outbreak is still unclear at the moment. However, increasing evidence suggests that the host reservoir of the coronaviruses is bats. Recent studies indicate that more than 500 COVID viruses have been identified in bats in China, with various animals such as the pangolin and snakes being the probable intermediate host for human transmission. Essentially, this means that the COVID-19 virus possibly mutated from bats into pangolins or snakes and mutated from these animals into humans. Pangolins are largely used by the Chinese for medicinal purposes, while snakes are consumed as meat in some areas of China. Now, how is COVID-19 virus transmitted to humans? This virus is zoonotic, meaning that it is transmitted between animals and people, possibly through the consumption or medicinal use of the carrier animals. The virus is subsequently transmitted from animal to one person to the next through respiratory droplets, such as coughing or sneezing. The respiratory droplets can also land on fomites or surfaces such as clothing and furniture and survive for many hours. Therefore, by touching these contaminated surfaces and reaching for your face with your hands, the virus can easily enter your body through the mucous membranes of your nose, eyes, and mouth. Now, before we answer the question of how exactly does the virus infect our bodies, we have to remember that on the medical scale of disease-causing microbes, there are bacteria, viruses, fungi, and parasites. The coronaviridae is an RNA-positive sense single-stranded virus that is enveloped and helical shaped. Now, the coronaviridae enters the human body through attacking the type 2 alveolar cells of the lung. The S spikes of the virus bind to the angiotensin II receptors present in the type 2 alveolar cells. Subsequently, the virus releases its RNA-positive sense single strand into the alveolar cells. Using the host cell ribosomes, the RNA-positive sense single strand is translated into viral polyproteins. At the same time, RNA polymerase enzyme creates a complementary negative sense strand that is used to generate copies of the positive RNA single strand. Thereafter, the new viral proteins and new positive sense RNA strands fuse together into new replicates of the coronaviridae. These replicates go on to infect other alveolar cells of the lungs and spread that way throughout the lungs. Currently, there is no specific treatment plan or cure that has been approved for the treatment of COVID-19. Each country has a different treatment regimen that is being used to treat infected patients. Currently, a variation of antiviral drugs is being used to inhibit viral replication, thus killing the virus. Secondly, a cocktail of prophylactic antibiotics is being administered to patients to prevent secondary bacterial infections. On the other hand, in some severe cases, corticosteroids, which reduce lung inflammation, are given to patients who are severely diseased. Oxygen therapy is also being administered to alleviate the difficulties in breathing that is experienced by some patients. The antimalarial drug chloroquine is used in some countries as an agent that inhibits the detrimental effects of pneumonia through its antiviral properties. Currently, there are a number of drugs that are being used as possible vaccines against COVID-19. One such is camostat mesylate. Now, camostat mesylate has not yet been approved as a probable vaccine. However, this drug is a potential protease inhibitor of TMPRSS2. Now, TMPRSS2 is a host cell receptor that is needed to facilitate entry of the virus into the type 2 alveolar cells of the lungs. When the expression of this receptor is inhibited by camostat mesylate, the COVID-19 virus is unable to enter the lung cells and attack. As we all know, prevention is better than cure. So make sure that going forward, you regularly wash your hands or sanitize and avoid touching your face. When coughing or sneezing, cover your mouth and nose with a tissue. Avoid close contact, at least at a distance of 1 to 2 meters between you and a symptomatic person. And lastly, make sure that you avoid the consumption of raw meat and uncooked animal products. Thank you for watching this video. Please do not forget to subscribe, to like, and to let me know what you think in the comment section below. See you next time.